Go.
This is just an initial walking sequence to work on some stuff with walking if I have someone maybe after a lower body surgery. One thing is that as we walk, we tend to start walking with a bent knee, or we tend to start walking with our foot turned out. So we want to do some things to correct that habit that we may start to form. So one thing, even if you're holding on with a cane or a walker or against the counter, I want you to think about trying to get your knee all the way straight and striking your heel as you take small steps, right? Each one I want you to really exaggerate that straightening of the knee and pulling your toe up as your heel touches. Then as your foot goes flat, your knee will bend a little. So I'd rather do this slow motion, small stride, right, versus taking a big step. If I take too big of a step, when I go to step, I may limp or I may kind of shift. So I really want to try to keep my body very squared, controlled. If that requires me to hold a cane or a walker, that's okay. But with each step, I want to emphasize that straight knee, pull the toe up, straighten my heel. Okay? This really works on getting my knee into a full knee extension, which is important with anybody, especially after a knee injury. The other piece is going to be working on the knee bend. So this one I like exaggerating more of like a marching type motion, where I'm bringing my hip and knee up high, right? And I'm exaggerating the knee bend. So just trying to really work on going a little bit deeper into these motions, because after any kind of injury or surgery, we see people walking with this stiff leg, right? So just watch from behind as I lift the leg up high. If you can see my waistline here, I don't want to lift it so high that I feel like I'm doing this. So I do want to feel like I keep my pelvis pretty level and my lower back. I'm really not shifting or pulling it out of position. I'm not excessively rounding my back to get it up there. I'm just trying to exaggerate movement through the leg without really compensating and moving anywhere else. Nice little easy drill. I have patients do this just as they're walking around their house. You may, if you're not in a hurry, you may just say, all right, as I go from the living room to the kitchen, I'm going to work on this little heel to toe drill. Maybe as I come back from the kitchen to the living room, I work a little bit on the high knee drill.